moment that you knew that you needed to bring mind, body, and spirit into your practice of medicine?
I think the first moment was probably before I even became a doctor. It was a recognition. I was 16 years old, and my father was 42 at the time and had just had his first heart attack. And when they catheterized him to look at his coronary arteries, they catheterized him in his right arm. And he was an engineer and a draftsman and relied on his right arm for his livelihood. And I remember thinking at that time that there was this amazing dichotomy between this miracle of medicine that could replace a man's heart, his arteries in his heart, and yet was so oblivious to who he was as a human being and what he did as a livelihood, that they never bothered to ask him the question about whether he'd prefer to be catheterized in the left arm or in the groin. And so I remember being really angry at the time that they were taking care of his body but not paying attention to who he was as a human being. So that was probably the first thing, and it was only much later that I realized that for my dad, just having a heart attack probably wasn't going to be enough to slow him down. That he had to have a heart attack and be paralyzed, because he was kind of a workaholic. But at the time, I remember feeling really angry about that. And then I think the next big thing was when I finished my family practice residency and was working as a family doc and seeing 25 or 30 people a day, and found myself just prescribing pills to treat symptoms. And even though there was a part of me that knew that there was more going on, I simply didn't have the time to address those issues. There was barely enough time to just get some information and write a prescription. And at that time, I very clearly was hearing this little voice in my head that says there's more to it than this. And as much as I tried to get that little voice to shut up, it just wouldn't shut up. And I knew that I needed to go back. Actually, that was when I went back to do a psychiatry residency to find out more about how the mind affects the body. And it's been kind of an ongoing journey since then to really learn about the body, learn about the mind, learn about the spirit, and how they all interact with each other. So it was probably that moment as a family practitioner where I was working 16 hours a day trying to address all the underlying issues that were going on, realizing that I couldn't do it in that kind of a setting.